So if you're getting any type of surgery soon, or maybe you've gotten any in the past, and just any type of procedure, you may want to watch this video. Okay, you know this thing that you're trying to maybe do something on the net, fill out a form, just anything on the net, and then they tell you, or maybe you're trying to do a verification on an app, and then you get to the point where they say terms and conditions, and it's like a very long list. You just have to check it. Most of us are guilty of this. I am guilty of this. I'm not going to spend time reading those tiny prints and looking at those details, even though it's very important. I mean, that's how you can see how much of your private data and what they'll do with it. You get how much of your private data will be requested from you. So I'm guilty of it. I'm not going to sit down and I won't read it. I'll just check it so I can move on to the next thing. Now, if you're going to get a surgical procedure, you may want to read your consent form very well. Or if you're like some people and you get easily distracted, you may want to get someone to read it for you. And please, if you're ever in a situation where you're supposed to sign a consent form, for example, it's a medical emergency, you're supposed to sign consent form for someone, take out time. I know it's like full panic mode depending on the type of emergency, but take out time to read your consent form very well. It will save you a whole lot of trouble. The story I'm going to talk to you about today is a true story. It happened to somebody I know. When she told me that, I was very, very shocked. Like, what? How didn't you even know? So I thought to come on here and share it with you people. So this lady had been trying for the longest time to conceive. She just kept trying and trying and trying. I don't know if she used to go for a regular checkup. She was actively trying to have this child, and everyone around her, like everyone was just being supportive, because previously she had gone through a lot. Now previously she had like a myomectomy. So on one of her hospital visits, she then discovered that she actually had an IUD she did not remember getting. She didn't remember getting this IUD. And this was why she couldn't conceive. So upon further questioning, just kept asking her, like, how do you have an IUD and you do not know you have one, and you were actively trying to conceive? So upon further investigation, I found out that this IUD was put there by her by her doctor after the myomectomy. And then I don't know, but I think maybe it was in the consent form, or maybe he spoke to her about it, and she did what most people are guilty of. If you're going to get a surgical procedure, you're supposed to ask. It's your patient's right. You're supposed to ask. You're supposed to know what this procedure is about, possible like things that can go wrong in this procedure. You're supposed to know. And if I know, like putting in like a contraceptive device is not like standard procedure, but I'm sure she should have been told. I mean, no one would just put an IUD in there and not tell you about it. Maybe she was told and she didn't really know what that was about, and she just trusted, she just had faith, okay, that he's not going to harm me in it. So you're supposed to ask questions, ask valid questions. So that's what happened to her. She had an IUD all along and she didn't know about it. It took just one hospital visit for her to find out that, oh, you have an IUD, that's why you can't conceive. And when she took it out, she was able to conceive. Now you may be wondering why would anyone put in an IUD or place you on any form of contraception after a myomectomy? This is for several reasons. Like, I'll mention just 3 in this video for the purpose of this video. The first one is that it helps to reduce risk of adhesion. That's after the surgery. So they may like place you on hormonal contraceptives, or put, for instance, like an IUD there. So it also helps to prevent pregnancy after a myomectomy. You know, a myomectomy is basically to improve fertility. So after your myomectomy, they may like place you on hormonal contraceptives, so you do not get pregnant immediately, so you can heal faster and better, and so you don't get pregnant when you're still trying to heal. So that's another reason you can be placed on hormonal contraceptives, or something like that can happen to you. The third reason is hormonal contraceptives actually help. Some help to manage complications or after effects of that myomectomy, like cramping, severe bleeding, and all of that. Now, you would get that information if you ask all these questions before your surgery. Don't just go and have surgery. You've not even read the consent form, you signed it. It's not proper. And apart from that, minus like the myomectomy, you should get like second, third opinion. You should get different opinions before you have that surgery. Understand what you're going to do before you go on with the surgery. You're supposed to ask questions. It's your patient's right. So what happened to her will not happen to you.